Welcome back to another episode of the Vet Series. Today we're going to talk about dental work and dentists.
And teeth, yeah.
And teeth, yes.
All things toothy. So I suppose a good place to start is that not all dentists are technically qualified.
Okay.
So when you are looking for an equine dentist, whether that's your vet or whether that is an EDT, if you're specifically looking for an equine dental technician, you want to be looking to see whether they are registered either as a BAEDT, which is the British Association of Equine Dental Technicians, or a qualified individual that has passed their examinations. So that's number one top tip. So obviously as vets we all do teeth. There are some vets that prefer it, and there are some very specific equine dental vets in the country, and that is their bag. At Seven Edge we like to think that we are trying to do our absolute best and to the greatest ability that we can, so giving you guys a really good service. So we have got a little friend with us to have a look at today. This is a really old pony who's got quite a lot of dental change. This pony, when I saw her, I did her about a month, 2 months ago now, she really struggles with long fibre. So when we're talking about hay, she eats very little. When she tries to eat hay, she quids. So when we talk about quidding, we're talking about chewing food and spitting it out. So you may see in a pony that's quidding balls of chewed up hay that's been rolled around in the mouth and then spat out because they can't chew it adequately enough to swallow. So should you notice that, that's the time in which to phone your dentist or your vet to come and have a look. So this pony we now are starting to maintain on shorter fibres, so mash feeds, hay and grass replacers, and giving her as much long grass as possible to eat because she's not got a lot left.
And how often would you advise that you see a dentist?
So annually as a minimum. Each horse is very different, so depending on how their mouth changes over time. Young horses, things change very quickly. So I tend to recommend having them done every 6 months. In older horses, so that middle age gap, so you've got out of that juvenile stage, you're heading into adulthood, those normally you can get away with 12 months. But obviously if things change or you're concerned, get them out sooner and just have it checked. And then as horses get older, case in point, usually more frequent, up to about every 3 months or more frequently even if needed, as pathology and things change quite quickly.
And what are some of the symptoms and signs that your horse, especially that's being ridden, is in need of the vet?
In a ridden horse, what we need to remember is that the bit is obviously within that gap in the mouth where there aren't any teeth. But if you've got any contact issues, that's really important to note. The noseband as well sits over the edges of your molar teeth on either side. So if you've got sharp edges that have developed, which is a completely normal finding in horses, it's what happens. If there are any sharp edges there and you've got a noseband sat over the top and your cheek is then rubbing against a sharp edge, you could quite easily cause an ulcer. So any sort of reluctance to take a contact, have your bridle on, be unwilling to allow you to fiddle with your noseband, etc., is a really good reason to have your horse's teeth checked.
Mm-hmm. And how often would you say that you have to sedate horses? Like do you sedate every single horse that you do?
I like to sedate my dentals because it gives me a better opportunity to have a really good look in the mouth. So then I can get in there with a mirror, I can examine every single surface of every single tooth to check for any pathology. So horses get caries or holes in their teeth that need fillings, just like humans do. We know that sugar can do that. So historically, before we were really aware of how much sugar was in feeds, we were feeding quite highly molassed pony mixes and things if we talk 10 years ago. Now our knowledge is significantly better, but there is a population of horses that were fed these sugary feeds that have got terrible teeth, just like we've got a population of children or adults who've got terrible teeth because we had a sugary episode. So it's one of those things that we do see, and you need to have a really good look in the mouth. If you just have a glance with your eyes, you won't look at the surface of the teeth to appreciate those changes. So by sedating them, it's a nice calm environment for everybody involved. I can have the horse really still, the tongue isn't moving and getting in my way, so I get a really good image of every tooth and I can see really clearly. And also it just takes the stress out of it for everybody involved. I think it's very easy to forget that I've got quite a large implement with a dental rasp in a mouth, and there's a lot of sensitive structures and a lot of soft tissue in there that could potentially be damaged. So if I've got a horse that's throwing its head around, if I slip or move, I could potentially damage those structures quite easily and cause a problem. So to start off with, when we are about to do a dental, I'll quite often have a conversation with the owner to say, Have you seen any problems? Have you seen any quidding? Is your horse eating well? One of the really good tests that we do, especially in older horses, is can they bite a carrot? It sounds really silly, but if they have any pain associated with their incisors, they won't be willing to bite into a carrot and take it from you. This pony, before I even get to doing any more, she has got very little in the way of incisors. So this little pony, if I ask her to bite a carrot, she probably won't want to because there's no tooth there. So the first step, once I have had a chat with the owner, is I tend to sedate my horses.
What are you doing now?
I'm having a listen to her heart before I sedate to make sure that she's a good candidate for sedation. Especially being an older horse, want to make sure that there's no reason why we shouldn't sedate. Good girl. Hey, sweetheart. Good girl, well done. Oh, you're a good girl. There you go. So, here we are looking inside this little pony's mouth. Now this pony has got pretty interesting dentition, so her teeth are not good, but she is really old, bless her. So as I'm looking in this mouth now, I'm looking at the surface of the teeth and does it look like there's a level grinding surface? Now unfortunately this pony's really worn her teeth in an abnormal way. So she has got overworn lower molars and she has got upper molars that I've had to rasp away previously, but you can just see that they're almost got a cup shape to them, so the inside of the tooth is just not quite as strong as it once was and it's worn in an abnormal fashion. If I then try and look at the other side, I don't know, can you see on the camera hand that she's got some food packing?
Can you see?
Can you see it? It's a bit steamy. So right at the back of this mouth, I don't know if you can see on the video, but there is some food packing in here where she's got some gaps between her teeth that have got some grass stuck in them. Now that's a diastema, that's what we call a gap. And she's got some that we need to pick out. On the opposite side, we're looking at the grinding surface, and there's not a level grinding surface in this little pony's mouth. We are working on it, but it's a work in progress. The next step in my dental examination is I get my mirror out to have a look at the surface of these teeth and examine them to look for any caries. So they're bits of tooth that are rotten and little holes that there might be. During this, I'm also looking for diastema, so gaps. You may be able to see on the camera that I'm looking at the surface of every tooth, and there's a lovely big gap there with lots of green fresh grass in, and then I'm carrying on looking through. There's a couple of teeth here that have got rotten bits, and we basically examine all the arcades looking to see what we've got going on. Is there anything there that we need to be aware of, that we need to make you aware of as clients? Write it down on our dental charts so that you've got a record of our findings. So in this pony, she has got some diastema. So they are the gaps between the teeth. Now you can either use a pick to pick out some of the food material. You can also use a washer. I have both in my car. I haven't got my flusher out now, so we're going to pick out some of the food material that's in between these teeth. So that fresh grass material's just come out of that gap between the tooth. You may also see your vet sniff this. Bit weird.
Go on, give it a smell.
Actually doesn't smell too bad. So in some horses, if they've got gaps where the food material isn't coming out very easily, it can be pretty rotten and it can be basically fermenting. So what we're doing is checking that that food material hasn't been sat there for a long time. And I basically work my way around the mouth, getting rid of all the food. So at 7 Edge we use electric rasps. We all have a battery powered rasp kit. Within it we've got 2 heads that we use. So we have got a flat disc. This flat disc is what we use to do most of our corrections. So that's where we're levelling off, taking off what we call excess transverse ridges. They're just bits of enamel that need reducing our sharp edges and correcting any overgrowths. And then we also all have what we call an apple core burr. So this is a shaped burr that we run along the edges of our teeth to help to smooth off those sharp enamel points. It helps to prevent recurrence of those enamel points particularly quickly. So that's sort of how I finish off my mouth. So we're going to give you a little rasp, aren't we, Sausage? And see how she goes. Good girl, well done. So when we're in the mouth, we are rasping backwards and forwards. In this pony, I'm going to be taking off a sharp enamel point. I'm going to be trying to take down some of these overgrowths in this mouth. And we basically make our way through the mouth, arcade by arcade, doing what we want. It's really important to keep checking and keep feeling so that we're not taking too much tooth. If we're taking down a big overgrowth, we'll be stopping and checking with our mirror multiple times so that we're not going into sensitive tissue. Horses do have sensitive tissue in their teeth just like we do, and there's only a certain amount of tooth we can take in one go. So you may find if you've got significant changes, we have to come back in 3 months to do a bit more work. So once I'm happy and I've finished with my disc burr, I then get my apple core attached and we're going to start smoothing off some of these edges. This is also known as profiling. So we go in and we are basically smoothing off those outside edges and profiling those teeth. Once I am done with that, without losing my pony, who's now very awake, I always give my ponies' mouths a little flush to finish to get rid of any tooth material that's in there. If I've got my flusher out, I'll make sure that I've reflushed those diastema. Good girl. And you're all done. If there's any recommendations or concerns, we'll make sure that we let you know and we can discuss how we're going to manage your horse's teeth going forward. Now that might be that we recommend doing a dental every 12 months, it might be every 3 months. Either or, it just means that you've got a plan going forward. Yes, I know, sweetie. So the last thing I do before I finish a dental is I always examine their incisors. So I have a look and see what they have got or not got in this case. Geldings often have what we call tushes or canines. They are really prone to developing tartar or plaque. So what we end up doing, if there's lots of plaque on there, we will clean it off. So you may see us with a funky pair of pliers, is the best description for them, cracking that plaque off those teeth. And then when we are properly done, you can go back to your stable and carry on eating, and I will fill out a dental chart and leave it with you so you've got a record of the treatment you've had.
And that is what happens at a dental appointment. What would you call it?
Yeah,
the
dental
dentist.
examination.
When the horses go to the dentist. Bye.
Is this really good pretending?
It's really good pretending, madam.
Excellent. Glad you like it. Fast forward.
Can we do like a bloopers reel at the end?
No.
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 Like this bit, like you're going to lose your horse.
My pony's running away. Oh, she's got a flat battery.
Oh.
You can pretend.
Okay. Hannah's disorganised because Hannah's not Beth.
It's because it's cold.
Can
it was
I say,
fully
can
charged.
I say that?
Yeah.
Yes, if you have to.